Hi guys! Today we're going to talk about adult acne, or what's commonly referred to as hormonal acne, and the best ways to treat it.
To be clear, most acne is caused by hormone changes, which is why many people experience it during puberty and their teen years.
Some people outgrow it, but hormonal acne can return once you reach adulthood, and it most commonly appears in women between 20 to 40 years old.
If you're not sure if you have hormonal acne, there are a few key things to look out for.
The first sign that you're dealing with hormonal acne is the age at which it appears. So while hormonal adult acne most commonly begins in the 20s, genetics also has a hand in determining when it begins. Sometimes it can start even later in your 30s and 40s.
Another sign to look for is if your breakouts occur monthly rather than randomly. If you menstruate, keep track to see if your breakouts are synced to your cycle.
You should also note where exactly your acne is occurring. So if you primarily break out on your chin and jaw, that can be a sign of hormonal acne.
Sometimes, if an area is particularly susceptible to getting clogged, you may also find that you're breaking out in the same spot every month, or have a sustained breakout for several weeks that's really hard to get rid of.
Last but not least, hormonal breakouts are often larger, painful bumps that form deep under your skin. We're talking about cystic acne.
If you only have an oily T-zone, whiteheads, or blackheads, then you probably don't have hormonal acne. These kinds of acne are caused by a combination of surface-level congestion and bacteria. So regular cleansing, exfoliation, and spot treatments can help to keep it under control. To be clear, you can also have these along with hormonal acne, but they're usually two separate things.
Some of the signs of hormonal acne also inform us as to what potentially causes these kinds of breakouts.
If you menstruate and your acne appears at the same time every month in relation to your period, that's a sign that it's a result of the rise and fall of your body's hormonal levels. Specifically, the fluctuations in estrogen, progesterone, and androgens, all of which can cause increased oil production.
These pimples also tend to form within the deeper layers of your skin. Because hormones are putting your oil production into overdrive, pores can get clogged in that area.
Other lifestyle factors like diet and stress can cause fluctuations in your hormonal levels as well. According to an article published by the American Academy of Dermatology, there are several small studies that link diets in high refined sugars and carbs to increase breakouts. However, there's a bit more research to be done in this area to definitively link diet and skin conditions.
Feeling stressed out can also cause these deep under-the-skin breakouts. When you're stressed, your body releases cortisone and other hormones, a side effect of which is increased sebum production. This overproduction of oil can clog your pores and increase inflammation as well.
So, now that we're more familiar with the signs and potential causes of hormonal acne, let's talk about the best ways to treat and prevent it.
Sometimes over-the-counter topical treatments won't be strong enough to treat hormonal acne, and that's because this condition is deep within the skin. So if you're not seeing results, we recommend you speak to a dermatologist.
It's best to consult a doctor when dealing with hormonal acne because they can prescribe an oral medication to help control it. If a cyst is particularly painful, they can also administer a cortisone shot to reduce swelling and inflammation almost immediately.
If your doctor recommends it, taking birth control can also help to regulate the fluctuating hormone levels that can cause acne flare-ups.
Cortisol, a hormone induced by stress, makes all inflammatory conditions worse, including acne. So doing your best to manage your stress levels can also help prevent breakouts and keep them from getting worse.
Cleansing, of course, is always extremely important, especially if you're prone to breakouts of any kind. Make sure that the cleanser you're using is gentle and non-stripping. We recommend using a cleanser that has a pinch of AHAs, like our Blueberry Bounce Gentle Cleanser, to help prevent dead skin cell buildup, which can cause breakouts.
Something very important to remember is to not pick at your under-the-skin breakouts. When a pore gets blocked by oil, dead skin, and bacteria, it can swell and break the follicle wall. Remember that oil pores are actually attached to hair follicles?
When a pimple is inflamed and breaks that pore wall, the contents can spread and infect the surrounding area. This is why it's especially important not to squeeze. Extraction should only be performed by a licensed dermatologist or esthetician.
If you're unable to see a dermatologist for treatment, it's best to let any under-the-skin breakouts come to the surface and to be consistent with spot treatments as well as a well-rounded skincare routine.
Hopefully, with the right care, your hormonal breakouts will go away. But what happens after they heal?
When your skin heals from trauma, it often forms dark pigments due to increased melanin production. If your pimple was particularly deep, it may take months for that hyperpigmentation to come to the surface and fade away.
Regular surface exfoliation using products with AHA or PHA can help over time to reduce the appearance of any dark spots you may have. We love using our Watermelon Glow Sleeping Mask, which is infused with AHA, either nightly or as a 10-minute wash-off mask to instantly give the appearance of brighter skin.
Vitamin C is also incredible at brightening an evening skin tone. We recommend using our Pineapple C Bright Serum, which has 3 potent forms of vitamin C every morning and night for an even complexion.
Retinol can also help with dark spots because it works at a cellular level to increase skin production from the bottom up over time, pushing out any dark marks or scarring and reducing their appearance. A favorite ingredient of ours is encapsulated retinol, which is just as effective as traditional retinol, but is a more gentle delivery method, so it's great for sensitive skin. We formulated our avocado melt retinol mask with encapsulated retinol and PHA, so you can use it nightly for best results.
Protecting your skin from the sun is important too, because too much sun exposure can darken any scars you may have. This is another reason it's important to wear sunscreen every single day.
If you're dealing with hormonal acne, we hope that this helped you learn a bit more about ways to identify, treat, and prevent it.
If you have any questions or tips, leave them in the comments below, and don't forget to like and subscribe.
Get your glow on!